Hello everyone, welcome. In this lecture, I'll try to focus on hypoxemia, hypoxia, and AA gradient. So let's first talk about hypoxemia. So hypoxemia is actually decreased oxygen, so it is hypox in blood. So typically decreased oxygen level is expressed by a decrease in arterial partial pressure of oxygen, and this is all hypoxemia. And one important indicator of hypoxemia, especially to find out the cause of hypoxemia, we use one very important indicator, which is AA gradient, which is alveolar and arterial gradient. Alveolar arterial gradient. And this is actually the difference between the partial pressure of oxygen in the alveolar air and the partial pressure of oxygen in the arterial blood, which is typically about 10 to 15 millimeters mercury, and most commonly less than 10. And this A gradient can be increased in some situations where there is, for some reason, there is defect in diffusion from alveolus to arterial blood. So there is for some reason, the alveolar oxygen cannot get into the systemic blood, which leads to an increased A gradient. So it can occur in case of shunting, when the blood bypasses the lungs for some reason due to VQ mismatch. So suppose someone having a pulmonary embolism, he will have a VQ mismatch. It can occur in fibrosis, where there is a defect in diffusion of oxygen from alveoli, so alveolar oxygen cannot go properly through the alveolar membrane to the pulmonary capillaries. So those are the causes of hypoxemia. So the cause of hypoxemia actually can be classified into two types. So in one group you have some causes which does not increase the A gradient, so normal A gradient, and in another groups there are some causes which increase the A gradient. So let's first look at the causes that does not change the A gradient. They are high altitude situations. So whenever a person is staying at a high altitude, the barometric pressure or the pressure of oxygen in that air is reduced. And that's why the oxygen entering in the lungs or alveoli have a reduced partial pressure. So there is reduction in partial pressure of alveolar oxygen. And next, this reduction in oxygen partial pressure in alveoli causes a reduction in partial pressure of oxygen in arteries too, and that's why both of them are decreased, leading to a normal A gradient. So this is one cause. Another cause is hypoventilation. This might occur in patients who are having less respiration, so if respiratory rate is very low, it can cause hypoventilation. Or if there is any obstruction in the upper airway, it also can cause hypoventilation. So in case of hypoventilation, you have a reduction in partial pressure of alveolar oxygen, so decreased alveolar partial pressure of oxygen. So as the alveolar partial pressure of oxygen is reduced, it causes a decrease in arterial partial pressure of oxygen, so the A gradient keeps normal. But in situations like diffusion defect, like fibrosis, the partial pressure of oxygen in the alveolus is normal, but as the air or as the oxygen from the alveoli cannot really penetrate the alveolar membrane well, the partial pressure of oxygen in the artery actually decreases. So there is, you can see, there is a big gap now between alveoli and the arteriole, leading to an increased A gradient. In case of a VQ defect like pulmonary embolism, the blood does not properly go through the lungs, so some of the part of the lungs are ventilated but they are not perfused, so there is a perfusion defect and there is a functional dead space, leading to a normal partial pressure of oxygen in the alveoli but a decreased partial pressure of oxygen in the blood, in the arterial blood. So A gradient is increased. In case of right to left shunt, suppose in situations like phallocytology, the blood actually bypasses the pulmonary circulation, so that's why it does not get the amount of oxygen that it should get from the alveolus. So alveolar oxygen concentration remains normal, but the partial pressure of oxygen in the arteries actually is reduced, leading to an increased A gradient. So this chart is very important, you have to remember it all. Now we have a practice problem here. A 32-year-old man is brought to the emergency department with severe dyspnea. His past medical history is unknown. An arterial blood gas analysis showed that the partial pressure of oxygen in his arterial blood is 62 millimeters mercury, and the partial pressure of oxygen in his alveoli is calculated at 71 millimeters mercury. Now, which of the following is the most likely cause of this patient's symptoms? You can pause for a moment and you can check the answer for yourself. I am solving the case. So as you can see, the partial pressure of oxygen in his alveoli is about 71 millimeter mercury, which is reduced. Normally you have a partial pressure of oxygen in alveoli about 100, but now it is 71, so it is severely reduced. And the causes of reduction in alveolar partial pressure of oxygen might be due to decreased oxygen in the air, an obstruction in the upper airway, or a decreased respiratory rate leading to hypoventilation. So we have our peak here, which is hypoventilation, which causes a reduction in the alveolar oxygen partial pressure. We have another problem here. A 43-year-old man is brought to the emergency department, has the following arterial blood gas findings. So here his arterial blood gas findings reads as pH is 7.25, partial pressure of carbon dioxide is 70 millimeters of mercury, bicarbonate level is 25 milliequivalent per liter. Now the patient most likely suffers from which of the following conditions? You can pause here and find out the answer yourself. I'm solving it right now. So as you can see here, the pH of this patient is reduced. So this patient is having an acidosis, first of all. Next, you see that this patient's partial pressure of carbon dioxide is very high. So this is a respiratory acidosis, and it is confirmed by the fact that bicarbonate level is quite normal. So this patient is having a respiratory acidosis. So respiratory acidosis can be caused by situations when there is hypoventilation. So any causes that decreases the respiratory rate can cause respiratory acidosis. And among the causes here, one of the important cause can be heroin overdose. So heroin is an opioid. So opioids always reduce the respiratory rate by inhibiting the medullary respiratory center. So this causes a reduction in ventilation or hypoventilation. So the carbon dioxide inside your lungs or inside your pulmonary capillaries cannot be expelled properly, leading to an increased partial pressure of carbon dioxide, ultimately causing a respiratory acidosis. Now let's talk about hypoxia. So what is hypoxia? It is actually a decreased oxygen delivery to the tissues. And oxygen delivery of the tissues can be calculated as cardiac output multiplied by oxygen content of the blood. So this equation tells you that hypoxia can be caused by a multitude of factors. So it can be caused either by a decreased cardiac output, which can occur in situations like heart failure. It can be caused by decreased oxygen binding capacity of hemoglobin. So this is telling you the bound portion of oxygen which is carried by the blood, or decreased arterial partial pressure of oxygen, which is the major determinant of the dissolved portion of the oxygen in the blood, and also it controls the bound portion of oxygen to hemoglobin 2. So here I have listed some cause of hypoxia which I brought it from BRS physiology. So there are multiple causes of hypoxia, starting from cardiac output. So if there is a decreased cardiac output, the blood which is oxygen rich cannot go to the tissue. So the tissue suffers from oxygen deprivation. In case of hypoxemia, there is a reduction in partial pressure of oxygen. So as there is reduction in arterial partial pressure of oxygen, it will lead to decreased saturation of hemoglobin, and also it will lead to a reduction in dissolved oxygen level. Anemia. In case of anemia, you have a decreased level of hemoglobin, and hemoglobin level is actually one of the most important determinants of oxygen carrying capacity of blood. So as oxygen carrying capacity of the blood decreases, the oxygen content of the blood also decreases. In case of carbon monoxide poisoning, the oxygen carrying capacity of the blood is also decreased because the carbon dioxide actually displaces oxygen from the hemoglobin. That's why the oxygen content of the blood also decreases. In case of cyanide poisoning, there is no problem with oxygen carrying capacity of the blood or dissolved oxygen, but the tissue cannot utilize oxygen due to defect in the electron transport chain mainly. Here we have a practice problem. A 32-year-old female has the following arterial blood gas findings. Here the patient have a normal partial pressure of oxygen, a normal saturation of hemoglobin, and a low oxygen content. Now the question is, which of the following is the most likely cause of the findings described above? So the way we are going to solve this question is seeing the important information given here. So here you can see the most important information is oxygen content is low. So as I have already mentioned, the oxygen content in the blood actually depends on 2 or 3 most important factors. And one of the important factor is the partial pressure of oxygen, which can be changed during hypoxemia. So as the patient does not have a decreased partial pressure of oxygen, the patient does not have any hypoxemia. Next important factor, and one of the most important factor, is concentration of hemoglobin in blood. So if someone has a decreased concentration of hemoglobin in blood, he or she will have a decreased oxygen content in the blood. And actually decreased hemoglobin content does not change the partial pressure of oxygen and does not change the oxygen saturation. So let's find out the cause which might cause the decreased hemoglobin concentration, and we found that, which is chronic blood loss. So chronic blood loss can cause a decrease in hemoglobin concentration, which will lead to a decrease in oxygen content, but it will not change the saturation of hemoglobin and it will not change the partial pressure of oxygen. We have another practice problem here. A 34-year-old man living on the coast suffers from chronic mild dyspnea. He lives a sedentary lifestyle and has smoked a half pack of cigarettes per day for 10 years. His arterial blood gas analysis shows a partial pressure of oxygen of 70 mm mercury and the partial pressure of carbon dioxide of about 35 mm mercury. Now, which of the following is the most likely increased in this patient? So there are multiple options here. You can pause here, you can solve it yourself. I am solving it myself. So the most important clue for me here is they have given 2 important values. So they have given you the partial pressure of oxygen and they have given the partial pressure of carbon dioxide. And now you can actually calculate the A gradient here. So before calculating A gradient, you can first calculate the partial pressure of oxygen in the alveoli. And so for calculating the partial pressure of oxygen in the alveoli, you have the equation here. So the equation goes like that: PaO2 is equals to partial pressure of oxygen in the inspired air, which is about 150, minus PCO2 or PaCO2 divided by 0.8, which is the respiratory constant. So here we have the equation, all the informations here. So 150 minus PaCO2, which is about 35, divided by 8.8. So here ultimately the answer would be like 106 or something. So as the partial pressure of oxygen in the alveolar air is 106 and the partial pressure of oxygen in the arterial blood is 70, the A gradient here is about 36. So as you can see, the A gradient is increased. So you can pick the answer where there is which of the following is most likely increase in this patient, which will be the PaO2 or partial pressure of oxygen minus partial pressure of oxygen in alveolar air minus partial pressure of oxygen in the arterial air, which is actually they are telling you this is the A gradient. So this patient is having an increased A gradient. So that's all from me today. Thanks for watching my video.